just quickly, anyone who's heard about One Health, type a 1 in the chat box. And then if you haven't completely don't know what One Health is, you can send that through the chat. The issue of attaining. If we want to attain a healthy population, which among the listed professions here, the nurses, medical doctors, public health officers, animal health specialists, environmentalists, and any other professions you might think of. So which among these do you think plays a central role in addressing population health? So we can have responses in the chats. You can send in an A or a B, or you can mention the profession. And if there's any other that's not listed in the slide, you can as well send a name. Jemima is saying all of them. Yes, I need more responses. There's teaching. Yes, thank you. From the niche. Then Oliver is saying C and D. Michelle, we lost your screen. Winnie Jebet is saying all. Continue sending in. All are concerned from Emma. Thank you. Yes, next slide. Thank you for those responses, and all of them were actually correct. We need everyone in attaining optimal health, whether it's a human health professional, animal health professional, environmental health professional, engineers, or any other profession that you might think of. Someone mentioned of teaching. Yes, we need teachers to educate, to pass these health promotion messages. We need art in form of, let's say, music or plays, skit, and so on, to pass this, to package and pass this health promotion information to attain healthy population. So this is a brief outline of this presentation. So you'll get to know about the speaker, and then I'll introduce to you the One Health approach, and then environmental health. Next slide. So this is, as I mentioned earlier, my name is Simon, and I'm a One Health champion, having participated in the One Health advocacy . I also participate in mentorship of primary schools and high school children through the Wings to Fly and the Equity Leaders Program. And, I also love research, and so I call myself a junior researcher because I've not gotten to those heights of consultancy and so on. And also currently, I'm taking part in the Hunger Net and Safety Program, which is a pilot project of the World Bank, trying to liberate communities suffering from extreme hunger in selected counties, arid and semi-arid counties in Kenya, and one of them is Marsabit County, which I am supporting currently. So next slide, Michelle. Now, we want to understand the relationship between the environment, animals, and human health, and where the three intersect. So taking a look at the environment. Environment is one of the key determinants of human health. You find that the issues to deal with the climate change, for instance, they are largely about our environment, how we conserve our environment. We have matters relating to issues like water, hygiene, and sanitation. These are things that relate to environment that eventually affect our health as humans and animals. Getting into the animals, which are part of the environment we live in, we realize that we somehow depend on these animals for sources of, let's say, food, the milk and the meat. We get the animal protein from these animals. And also these particular animals release some amount of waste to the environment. For example, the gases, the methane from the animal wastes. So all this comes to the environment, and in the long run, it has an impact on the health of humans and the well-being of the environment. Now, the humans here play a central role because they are the ones who manage this environment and the animals. So actions like deforestation, for instance, they might lead to detrimental effects like drought and eventually climate change, you see? So we find an intersection between animals and humans in the So this is where now the three components intersect, and this is where we have to put our concern in, and that is where we now find what we call One Health. Next slide. So I think this question we already addressed in the earlier stage. If you've had next slide, Michelle. Now, in summary, this is what One Health is, according to the Center of Disease Control and Prevention. So we have the three basic pillars, which is coordination, communication, and collaboration. Of key importance here is collaboration. So if we are told to attain optimal health for the three components, the human health, animal health, and the environment, we must have constant collaboration between partners and professions. We must have adequate coordination and communication for us to be able to join our efforts to attain optimal health for the three One Health components. Next slide. Now we have what we call the One Health challenges that we encounter in the interactions between among the three components, the human, animal, and the environmental health. So we might face issues like the AMR, antimicrobial resistance. You find there's AMR in animal health, there's AMR in human health, and then there's the environmental drivers that propagate the AMR epidemic. When you come to issues like communicable and non-communicable diseases, there are environmental factors that that propagate these particular diseases or disease occurrence. Let's say issues to deal with, let's say cancers that are related to unclean air. You see, the gases are emitted to the air, we get to inhale them, and then eventually we develop such respiratory diseases. You see, issues with communicable diseases, let's say an issue like cholera, you see, it comes through, let's say, contaminated food sources or the water. You see, this is all revolving around the environment, and you can see there is possible transmission from even the environment to the humans and then to the animals. Some of these diseases are actually shared. We have issues like sanitation, I've mentioned, climate change, and so on and so on. And then we have issues with urbanization and land use systems. You see, the issues of urbanization, for instance, and settlement. Let's say the settlements in peri-urban areas or the slums, for instance, you can find a lot of issues to deal with sanitation, hygiene, and informal settlements, you see. So that promotes the onset and occurrence of many of these mentioned diseases. So when you look at the sustainable development goals, for instance, you find that there is one that deals with good health, another that deals with climate, environment, and others with water, you see. So you find that all the SDGs, they revolve around the One Health pillars, the three: human health, animal health, and the environmental health. Next slide, Michelle. Now, there are benefits that come with collaboration in health. One of them being we are living in a complex world. We every day um, encounter emerging diseases. For instance, the emergence of COVID. It comes as a complex challenge. And so it needs like a complex solution. You see, complex solution for a complex problem. So if we do not collaborate, it might not be very easy to eradicate some of these emerging diseases and emerging global health threats. We also attain optimal health outcomes through collaborations. You see, when we join teams together from the environmental health professions, human health professions, and any other profession that we just mentioned in the beginning of this session, it is very likely that we are going to attain optimal health, and we are also to have economic benefits arising from this, because we are spreading the cost, we are sharing the cost among the multiple stakeholders that we are bringing on board. We are also having improved coordinated efforts. Yes, if we join our hands, like there's proper coordination and we are pulling together these teams, these professions, it could be easy to run things and respond to some of these outbreaks. Next slide. Now, taking a deeper look into the environmental health, the World Health Organization, back in the year 1989, defined the environmental health as those aspects of the human health and diseases that are determined by factors in the environment. These factors could be natural, for instance, the flora and fauna, human and the animals and the plants. We have the water bodies, for instance, and all those. And then we also have the aspect of built environment. You see, we have issues to deal with settlements. We have issues to deal with housing. You see, all these form part of the environment that eventually influence human health in the long run. So all these efforts are targeted towards preventing disease and creating a health supportive environment, which we call ensuring better public health practice. So some of the components, okay, we have here broadly up to 5 components of environmental health, one of them being environmental epidemiology, studying disease patterns, causation and prevention and control of these particular diseases. Let's say an instance of cholera, you see. And then we have toxicology. This comes with the issues of unclean air and pollution. Then exposure science. You see, we consume, for instance, we consume food that might not be safe to us, and environmental health looks into all those through food safety and meat inspection, let's say, and all those stuff. And then we have environmental engineering. This is now where the built aspect of the environment comes in strongly. Environmental engineering, for instance, we need like a plumber to fix an issue that deals with maybe drainages to prevent an outbreak of a disease like cholera. And then we have environmental law. There are some of these laws. For instance, we understand the international health regulation laws. We have in Kenya, we have the NEMA Act that try to protect the environment. We have many public health laws and environmental laws that are geared towards the well-being of human and animal and environmental health. Next slide. Yeah, these are the issues I just highlighted. We have housing, water and sanitation, all these lie under the environmental health. Food and hygiene and safety. We have health, education and promotion, school health services. We have air pollution control, and then care of the dead. That's also an environmental health aspect. And then we have market sanitation, prevention and control of communicable and uncommunicable diseases, then noise pollution. It's not only limited to this, because it's wide and wide and wide and wide. Now, in summary, what are we saying here? We are trying to say that the human and animal and environmental health are actually interconnected. So we can never attain um, optimal human health or animal health without factoring in the environmental health. Having understood the scope of environmental health, what environmental health covers, you realize that it's actually nearly impossible to attain human or animal health without having key consideration in environmental health. Also, there's strong need to adopt the One Health practice in addressing the current global health challenges we are facing. For instance, issues with food safety and food security, the issues with emerging and re-emerging diseases. Taking an example of COVID, we really need to adopt the One Health approach in addressing such complex societal challenges, which we sometimes call them wicked, for us to be able to holistically address and mitigate the so-called wicked challenges. So that's the end of my presentation. I will take questions, but later after the next speaker. So I'll hand over to Esther. Thank you.
Hello, Simon. I hope you can hear me. Thank you so much for the brief introduction on One Health and also incorporating the environmental health aspect. And as we move into the webinar, we'd now like to go into our speaker for today, Mr. Dan Magoha Ayuka. I hope he's around. Mr. Dan Magoha.
Yes, I'm very much around. Sorry. Yeah. So
okay.
there's someone who I was just receiving a call. Just hang up on it. Thank you. Yeah, I'm around. So are we ready to start, or should I introduce myself, or you'd introduce myself?
I'll briefly introduce you. Then you could take over and just begin the webinar. I'll give you host sharing rights. So Mr. Dan Magoha Ayuka is an expert in programs, planning, monitoring, and evaluations, and reporting with 10 years of experience with public health sector and humanitarian emergency response programs. Currently, Mr. Dan is working with the WHO, World Health Organization, as a technical specialist under COVID-19 surveillance and contact tracing. And he also leads the WHO COVID-19 response in the Kenyan coastal countries. And most recently, Mr. Dan has been working with the WHO as NPO, or the Monitoring and Evaluation Officer, covering UHC pilot implementation in Kenya from June 2019 till March 2020. So with that brief introduction, thank you so much, Mr. Mogaka, for accepting our invitation to be a speaker today. So I'll give you the floor to dive right into the topic for today. Welcome.
Okay, thank you very much, and I'm very happy to meet the the Moi University team and to also have a discussion. I really enjoy discussing with students. We went through the similar scenario over the past years, and by the time I completed my university in 2011, it's been really a journey, and I really enjoy discussing with all of you. So I'm going to take you through the theme for today, and let's feel free to raise, after the presentation, let's have a concrete discussion. So today we're going to discuss about environmental health and planetary health, as well as the role of environmental health in infection prevention, infection control and prevention, with more focus on COVID-19 as well as other communicable issues that we have within. So in a nutshell, so I've divided this into two components. So the first component will be basically discussing more on the environmental health and planetary health, and we'll discuss more on the role of environmental health in infection prevention and control. So on the first module, at the end of it all, I want us to be able to describe some of the major global challenges that we have that is impacting health, which is really, really very crucial because, the environment is where we live in, and whatever activities that we do basically impact the environment either positively or negatively. So when you're looking at planetary health, there are actually 11 indicators that you have to look at. One of them is the population. So over the last century, we've been able to see a tremendous increase in number of population. So the poverty level has also gone tremendously reduced because some of the well-developed countries have more income. So that basically means the level of poverty is going now, but we have countries that are lagging behind. So the other indicator is on life expectancy. So generally, in the globally, the life expectancy has gone high, but I know this can be disputed because in other countries the expectancies have gone down, which is also will be further discussed when we move forward. The energy use has gone high because people are engaging in more production, they're engaging more activities. So even in water use has also gone up. Looking at the domesticated land use has also gone high. So looking at the planetary areas that we have to look at, according to Stephen et al., the research that they did in 2015, we have various components that have to fresh water use, then land use system. People are changing various ways that they're using the land. Looking at the atmosphere integrity, we're having flights moving all over, people launching, everything all over. People are fighting, they're launching rockets. So it also revolves around that. Now, when we look at the entire global, we've noticed that the level of emission has tremendously gone high. And if you look at this modeling, it's going to even be more higher when we move towards the 21st century. Further that, these are now the actual other indicators that you can look at, like the tropical forest loss. It's continuously being depleted. Looking at the water shortages, looking at the ocean acidification is also going high. Temperature change is also increasing. Looking at aspects of biodiversity is going down. So in a nutshell, when we look at all that, it basically tells us that, we have a lot of things that we need to play around with so that we can be able to ensure our health is not tremendously impacted. Now, we know very well that Africa and Asia Pacific, previously they've been lagging behind. And, with more industrialization, it's predicted that over the coming years, Africa as well as Asia will be the greatest emitters of the fossil as well as all other, greenhouse emissions. And we'll be able to see the areas that like Northern America, Western Europe, as well as Middle East and all other countries moving down. So this actually tells you that, with more emission and with more industrialization, that basically means also a greater impact to health in areas that we're working in. So let's look at also the other indicator on water stress level. So you can be able to see with even Africa lagging behind and looking at the other continents, over the coming years, we're going to see a scenario where Africa is also going to be greatly affected. So that one also makes us really means that all of us have to start thinking what are some of the things that we basically need to put in place and ensure that we are not greatly affected. Now, this is now the summary that I tried to compile that maybe within your time, I'll be able to share this presentation. You can actually dig deeper and have a clear understanding. So from what I've been able to present, we can be able to see that there has been an escalation of human pressure on the global environment. And this has brought some specific changes within the environment and the ecosystem. So I've been able to list that and some of the examples of health effects that are going to have. So we're having direct health effects, we're having those effects on ecosystem, and as well as the indirect effects. So this one, you're going to have a look at it deeper, and we could actually have a discussion even after. So if I could be able to actually point out a good example like the direct health effects. We're having floods, heat waves, water shortage, landslide, exposure to ultraviolet rays, as well as exposure to pollutants. These are some of the things that we're actually seeing as of now. And over the years of working, I've been able to respond in various kind of intervention, not only within Kenya, but also even up to South Africa, in South Africa, as well as Southern America and the Caribbean region. So I've been able to work in these areas, and I've been able to see some of these direct impacts in real life. And if we are not able to actually resolve, we're going to have a situation where the world is not going to be habitable for us. So among the ecosystem aspect, like for example, the disease risks continue to go high, reduced food production. We're having people who are undernourished, as well as stunting cases will continue. Then issues to deal with depletion of human and natural medicine, as well as mental health. So these are some of the things that we're going to see under the ecosystem, and it will be more pronounced when we move towards the 21st century. Now, the indirect effects, we're having issues to deal with livelihood losses, as well as seeing people being displaced. A good example within Kenya, even this year, we're seeing, like for example, in Laikipia, with reduced water and food shortage, we're having that conflict between farmers as well as pastoralists. So these are some of the things that we're likely to see when we're having more pressure to the environment. Now, looking at that, so in a nutshell, on what we've been able to discuss, when we enter into 21st centuries, we're going to have more globalization, we're going to have more urbanization, poverty is going to be more pronounced because with increased pressure in the environment, we're also going to have socioeconomic inequality, where we're having more richer population as opposed to underprivileged population. Then aspects to do with food insecurity, environmental degradation, as well as the demographic transition. Now, when you look at the globalization, it's just in a nutshell, looking at what was happening in the 1960s, as well as then you compare with what is happening right now. There has been increase in the amount of trade, as well as global GDP. It's tremendously increased globally. Now, this basically means people are moving more, and there's more migration, and with that alone, it brings impact to the environment. So many low to middle income countries, they are continuously to be more industrialized, and this one is also bringing consequences to the environment. Even the same situation is also under urbanization. Then the same situation also is being seen on aspects of governance. When we have more people in the population, and that specific impact also, it impacts also the way the world is running. Another thing, in the past, traditionally, people, they were not moved by products, but as it is right now, we're having more aspects that are moving the world, and people basically want to shift into that and fit into what the current way of life is. And with that speed also, it also pushes human beings to engage in more effects, in more ways that are affecting the way we're living within the societies. Another thing that we have to put keen interest on is on social economic inequality. So, with socio-economic inequality, basically what this means is that with increased, looking at the way people are interacting, people are trying as much as possible to ensure that they are having a better economic situation. And, with that one also, it brings disparities all over the world, and as well as inequalities. And so a solution has to be sought around that. So that's, I've been able to discuss around that. So this is how the inequalities are distributed. So you can be able to see in the 1980s where Africa was and where Brazil as well as the US were. And as of now, you can be able to see where the trends are actually going. So in a nutshell, a solution has to be found as soon as possible so that we can actually be able to ensure that we're having a healthy environment. So we are having a rising income and inequalities, as you can be able to see within the graph. So there's also increased food insecurity. This can actually even be more pronounced within the African context. And with more, we experiencing a situation where people are not able to actually access a more nutritious or affordable food. Then in addition to that, also we're having some of the issues, like for example, having foods that cannot be edible, because with mixture of chemicals and the food that we use, people are using whatever means to to do fumigation, as well as irrigating their farms whenever they're trying to control pests. This one also greatly, tremendously affects the way we're doing, the way the world is. Now, with more cultivation, we also, leading to environmental degradation. So, with that one also will lead into challenges to do with the way, whenever you're doing, farming and all that, you are actually trying to expose more, more of the, destabilizing the way the ecosystem looks like. And this one also will lead to, pruning of the vegetation and all that. So the normal way that air circulates is also going to be greatly affected. So some of the areas that have been affected, through it's more ranging from air, looking at land, freshwater, oceans, as well as biodiversity. So, and you can be able to see the way the impacts are. Some of them can easily be reversed, while we have those ones which can be stable, and we have those ones that can be completely irreversible. The demographic transition is basically, relating to, with more urbanization, with more people interacting, we'll have a tremendous increase in the number of people and high birth rates, which will also going to bring pressure to the environment, with more, having issues to do with NCDs, chronic illnesses, and all that. So that's the end of part one. And from that, you can be able to learn that with the environment, more needs to be done, and more needs to be done to be able to control the level at which we are emitting the fossil gases to the environment. Looking at the role of the environmental health and infection prevention, those who might have participated in the previous webinar that I did last time, basically comprehensively captured some of the things that to do with infection prevention. Like for me, over the years of working within the COVID-19, so it actually revolves around how we're engaging with the environment. And for us to be able to control the disease, we have to find a solution as soon as possible. So I'll not go deeper into defining environmental health because this has been captured by previous presenters. So I'll take you through a short video, which I think we might have covered before, which will be able to summarize and tell us, looking at how we are dealing with the environment.
Poa. Dharura.
So as you can be able to see, that one basically has summarized everything that we've been discussing. So because you can see in the past, we were getting a good amount of food, the environment was good. Now with more industrialization and with more people engaging with more human activities, we now are ending up, feeding in what is not good for our environment. So as you can be able to understand that, the transmission chain of every infection is actually cross-linked with the environment. So the way, it's very critical for us to actually understand that for the environment to be perfect and for us to be able to control the infection, we have to ensure that the environment that we are in is in a good way, and we can be able to produce and eat whatever that is within the environment in a proper way. As we can be able, all of us can be able to go back to the epidemiological triad, you can actually be able to understand that the environment actually plays a critical role in balancing the agent as well as the infection that is actually infecting the host. So the moment an imbalance actually happens within the environment, that is going to tremendously affect, and that's why we currently we're having a lot of infection coming in, a lot of vaccines, being required, and this was not this was actually not the situation in the 18th century. Now, looking at some of the environmental factors that are affecting, that are leading to this infection and imbalance, we know we actually have, they can actually be broadly classified into three areas. We're having like the physical factors, like the climate, looking at the biological factors, for example, like the insects or mosquitoes. We're having like a good example, like under the social economic factors, living in crowded places, aspect of sanitation, and availability to health services. So these are some of the critical things, that have to be, put into consideration whenever we're ensuring that we're controlling the infection. Further that also, some of the factors that we have basically include, like example, the water supply, sanitation facilities, looking at the food that we take, and the climate. So these are very critical things, because without water, we're actually not able to prevent most of the preventable diseases. When we do not have sanitation facilities and people are doing open defecation, we're actually exposing the entire world into an imbalance where more infection is likely to come. Then when we have food shortages, we're having a lot of, the immune system is not going to be well functioning, and even some of the infection that the immune could be able to fight, will actually not be able to fight. Looking at the climate imbalance also exposes us to more risks too. And for us to be able to prevent, we actually have to put in place various interventions. And one of them is like improving access to safe water, ensuring that we're encouraging a practice of hand washing, reducing the use of solid fuels, aspect to do with improving access to low carbon energy technologies. So through that, we're actually going to ensure that the balance within the environment are actually ensured, and that we are not putting an imbalance as well as provoking the environment to have more infections. So this is how the history of the pandemic has been since the 13th century. So as you can see, when we move towards the 21st centuries, we need to prepare ourselves to have more pandemics. Because as you can be able to see, like a good example, between the 13th century to 18th centuries, we only had around 4 pandemics. But from the 18th centuries to now, it's uncountable. So this actually can be able to tell you that we need to get prepared when we're having more human activities. So we also need to ensure to get prepared that we're likely to have more pandemics. So this is how the situation has been, even as of now. And that's actually also a snapshot on how the pandemics look like. This one also provides a snapshot on how the flow has been over time, as well as looking at the number of people who've been affected over time. And as of now, the COVID-19 actually is more pronounced than even Ebola than any other. So when we're talking about the infection prevention, it actually boils back to an individual responsibility. And for us to be able to ensure that the IPC systems are in place, this has to be looked at, ranging from level 1 up to the level 5 situation. And the video that I'm trying to show you can actually cross-link, because when you're working in a hospital setting or an environmental setting, all of us are human beings and we are in close interaction. So whenever we pick an infection, we're likely to also infect others. So it's very important for us to ensure that we break this cycle of infection by ensuring that we maintain the various aspects that I've been able to speak about earlier. And the environment actually plays and provides a suitable environment for us to be able to control the infection, but also the environment can actually play a critical role in ensuring that the microorganisms can actually be able to spread faster. So let's look at this hospital situation, and from our own observation, we can actually be able to have a level thinking on what we need to put in place to ensure that we actually actually prevent the infection whenever we are. So this should be among the last slides. Then we can end. That's one example in an hospital setting, and we have various examples that we can be able to actually look at. So so that's it for today. I've been able to try and summarize the 3 areas. So in a very short version, but in an ideal scenario, this would have actually been a one-day discussion where we're basically looking at all those components. But as of now, I'll request to pause it here, and then we can start having questions, and then we can actually be able to engage more and actually give practical examples. And that's over from my side. Thank you.
Okay, thank you, Mr. Thank you, Mr. Mogaka Dan Ayuka, for the wonderful presentation. I'd like to invite anyone who has any questions or comments concerning the presentation on World Environmental Health Day. The floor is open. Simon, what do you have to say about the presentation?
Hello.
Hello.
Yes, I can hear you. Thank you, Buana, for the wonderful presentations. I think from these presentations, we've actually been able to understand the relationship now that comes in, even bringing in now the One Health concept. We are now able to understand how these things interrelate and how we are able to optimal health for our populations globally by utilizing even the One Health approach. So even today's theme is even highly relevant in that we are celebrating the World Environmental Health Day. Yes. Then we are looking keenly into prioritizing this environmental health so that we can attain healthier communities as we try even to recover from the current shock of the COVID-19 pandemic. So a take-home message from here should be like we should all be geared towards prioritizing this environmental health. For instance, the IPC from the wonderful clip with just saw towards the end of the presentation. So that's a very strong take-home message that we should prioritize environmental health in terms of sanitation, whether it is about settlement, IPC, control of diseases, and so on. We should prioritize EVH for us to have a healthier communities. So members, maybe you can share your comments, your ideas and questions to whether it's for the first speaker or the second, so that they can be addressed.
Okay. I have a question. What initiatives have you pioneered in infection prevention and control?
Yes,
thank you. So okay. Can maybe we get a number of questions, then I can respond at once.
Oh, it's okay.
There is another question in the chat, Esther.
Yes. I'm actually seeing questions being raised in the chat box. Thank you for creating awareness on this important topic, something that we tend to ignore. That's from Caroline Macharia. Bashunga, thank you. I would like to ask how this system or collaboration of One Health can intervene in inhibition of this COVID-19 pandemic. From Oliver at Singer, this presentation just shows how we need to work on public health in order to achieve great health targets. Thank you for the presentation, sir. Anyone who will wish to add any more comments or questions, you can feel free to do so.
Thank you very much. So if I could give a shot while others continue to provide the inputs. So one of the questions has been have been able to be asked that some of the initiatives that we've been able to pioneer on IPC. So when COVID-19 pandemic started, there are a lot of things that we were actually able to put in place when responding to COVID-19. As you can be able to remember, COVID-19 actually, some of the initial counties that reported the cases were Nairobi, Kilifi, as well as Kwale, then Mombasa came in. And the reason why I came to the coast was because contact tracing was a problem. Now, by coming to the coastal counties, I had to spearhead some of the initiatives to be able to put in place. And one of the systems that we were actually able to put in place was ensuring that the rapid response team can be able to respond better. Now, when you get out to the field and be able to do a lot of activities when it comes to epidemiology, rapid response team actually play a very critical role in ensuring that the infection are controlled. And this one is actually bringing together all the health focal points, like the PHOs, the clinicians, the nurses, the medical officers, the pharmaceutical team, as well as the lab teams, working closely together in ensuring that they respond to whenever they're detecting cases. So these were some of the things that we're actually able to be able to put in place, and we've been able to design a lot of things over time. And this one also has been able to assist us to ensure that we control the infection at the coastal area. So these are some of the photos and initiatives that we've been able to put in place, ensuring that we respond better and that we actually detect cases. As of now, also, you actually realize that we're having various variants basically kicking in. So some of the things that we've been able to put in place is ensuring that we work closely with Cambridge to ensure that they run sequencing. So this one also goes further to ensuring that we also provide grant to the institution so that they can be able to assist in the surveillance activities. So this one will as well as to be able to know what kind of variants we are dealing with, then what kind of strain. This one not only is for COVID-19, but we're also doing the same for measles, we're doing the same for polio, as well as other immunizable diseases. And those are some of the initiatives that we've been able to put in place over time. And in a nutshell, that is how we actually doing the response. So maybe towards the end, I'll be able to show you a dashboard, or maybe share a link to the dashboard where you can be able to see some of the things that we are doing while responding to COVID-19 pandemic. Over.
Thank you, Dan, for the comments. And I would like to add something regarding the question asked on about One Health collaborations. How the system or collaboration of One Health can intervene in inhibition of this COVID-19 pandemic. So as Dan just mentioned, there is quite a lot of collaboration when it comes to, let's say, constituting a rapid response team. You will definitely need a multidisciplinary team when responding to an outbreak. For instance, you'll need laboratorists, you'll need epidemiologists, you'll need public health officers, you'll need nurses, you'll need let's say medical doctors, you will need maybe people to deal with logistics. So that's already a multidisciplinary team that is helping you to respond to this particular outbreak. So In so doing, in responding to such an outbreak, you will be utilizing the core pillars of One Health, which is communication. For you to for you to realize success of you must communicate your team. See, Dan also mentioned in like Camry and even operations have been very key in respond to these outbreaks with COVID-19. So One Health collaboration is actually adoptable in mitigating of any global health challenge that might come to your mind or that you might face in the current world.
Okay, thank you, Simon, for that. Another question. I would like to ask how this system or collaboration of One Health can intervene in inhibition of this COVID-19 pandemic.
I think that has been answered.
Another one is, how can you rate the environmental health before COVID and currently? Then another one is, what is the success rate of collaboration among individuals from various fields of specialization in quest to see One Health approach succeed?
Maybe I can go respond to that, and then I'll ask Dan to respond to the previous question about the environmental health before and after COVID. So about the success rate of the One Health approach, as opposed to the traditional, let's call it traditional silo approach. Let's say where a situation where disciplines were working in isolation, you find medics working on their own. You find, let's say, the animal health sector working on their own. You find the guys in the environment are working on their own. So with the emergence of this pandemic, the COVID-19, you realize that, okay, it was linked to have originated from the animal species and then spilled over to the human beings, of course, through another intermediate host. So let's say now we want to look into the root causes of this particular COVID-19. You will definitely need to bring on board multiple disciplines. You need to deal with, to bring on board, let's say, the wildlife. If, of course, the suspected animal of origin is a wild animal, you bring on board the wildlife. Animal health specialists, you have to bring them. You have to bring the researchers, of course, the clinicians, and all those people. Then you see, now imagine trying to investigate such a scenario as a single profession. Let's say only researchers working in isolation trying to mitigate such a challenge, trying to investigate this disease. You see, you can now compare the how successful, how likely is this guy working in a silo, how likely is he to succeed as opposed to the other team that is like a whole team that is composed of those key professionals or disciplines that are teaming up to address this particular challenge. So what I'm trying to say here is the principle of collaboration. It is very key, and that is what One Health is trying to advocate. So the success rate is, I would say, it's quite high when we collaborate as opposed to working in silos.
Okay, thank you very much. So if I can be able to whenever you one of the critical things, once I believe some of us, once we finish our undergraduate, we will have interest to engage in some of us will have interest in field epidemiologies, others would be interested in M&D, others would be interested maybe in other fields. But you'll be able to realize that when we're working collaboratively as a team, we normally have a maximum impact as opposed to working alone. And over time, for the last years of working, I've been able to realize that, with teamwork, we're actually able to do more because we're bringing in place various expertise as well as ensuring that we provide a critical solution within the shortest time. A good example, as a PHO, I cannot be able to ascertain whether this infection, what kind of infection it is, if I cannot be able to work closely with the lab team. And at the same time, I cannot be able to, a medical practitioner cannot be able to diagnose a given disease if he or she cannot be able to rely on a given team. A good example can be the lab team, giving them lab samples, be able to run and be able to do a proper diagnosis. Now, in relation to the question on how we rate environmental health before COVID-19 and currently, so I think COVID-19 has been able to bring a lot of learning, and we're still learning over time. So we're still having a lot of gray areas, and some of the areas are still having a long way to go. So what I can be able to say is that environmental health continue to experience more learning, and the COVID-19 has been able to give an opportunity for us to be able to think better and ensure that we put whatever resources and energies in ensuring that we control the infection. In relation to some of the measures that have been able to be taken to ensure that there's an increased biodiversity, as of now, we have a lot of key players over, and I actually happen to sit in some of the global field. A good example, I sit in an organization called Evidence Frontiers as a board member. And some of the things that we look into is ensuring that how the financing for environmental health looks like, how are the grants being supported, and all that. So, and previously I was also sitting in a board where we were awarding grants for the Caribbean countries when I was working in the Caribbean. So within that board, we were actually able to determine some of the interventions that would be able to roll out in ensuring that we prevent frequent hurricanes as well as storms by ensuring that we invest where it's actually needed and ensuring that we have green energy solutions. So I think there are a lot of initiatives being done out there, and various countries are becoming more interested in funding some of these initiatives. So that's what I'll be able to comment on that, because it's still work in progress until we actually ensure that we control the greenhouse emission and that the world has gone green. That's over from my side. Thank you.
Okay, thank you for that. Another question is, what are some of the measures, if any, have been taken to ensure an increase in biodiversity, and what steps can be taken to improve the same?
I think I've answered that.
Okay. Kindly elaborate on how farming leads to environmental degradation, I think, and some of the ways to reduce or curb effects from environmental degradation. I think that also has been tackled in one of the slides. Water security is a major challenge, particularly in sub-Saharan Africa. In general, how can be adequate, clean, and fresh water be at a sustainable level?
Okay, on that question is, I think it's a two-faceted, it's taking a two-faceted approach. So practically speaking, it's going to be very difficult and very expensive to harvest water from the ocean. So the fastest way to do is to ensure that we plant more trees, and that the earth itself can be able to produce and be able to ensure that rain formation can be able to be seen. I know some countries have tried to develop artificial rain. This has had positive and negative impact. So, but for us to be able to have adequate and clean water, we need to have to focus more on ensuring that we're having a clean environment, and that the forest cover can go back to the way it was previously before deforestation. So that will be an answer for now, because harvesting water from the ocean is going to be very expensive and unsustainable. Many countries have tried, and it's been a very difficult challenge for them. Over.
Okay, thank you. I can see there are no more questions in the chat box. Or is there anyone who has something to add basing on this presentation?
Okay. It was a great presentation. I've learned a lot. Thank you, the presenters.
Thank you, Fabius. Anyone else who has anything to add? Simon, you can conclude the meeting. Thank you so much, our guest speaker, Mr. Mogaka Dan Ayuka. I think Simon has been disconnected.
Esther, hello.
Hello.
I'm back.
That's good.
Maybe I didn't hear you. Did you say anything while I was disconnected?
Yes, maybe you can conclude for us the meeting. And you are suggesting like, let's have the icebreaker, then we end the meeting.
It's okay, then Michelle can go with the icebreaker. Then we close.
Michelle? I think she's having problems with her internet connection.
Okay, it's fine. Then I think I can go. So, ladies and gentlemen, let me take this opportunity to thank all of you for taking your time to join this particular session. More so, thanks to all members. I understand the organizers might have shared with you the link on a short notice, probably, but then it shows a great commitment for you all to turn up to participate in this event as we mark the World Environmental Health Day. Thank you so much. And to our guest speaker, Mr. Dan, we thank you so much. In here, we have students from University of Nairobi, from Moi University, from even other universities outside Kenya. We have students from Rwanda, and we would like to recognize their presence. And this all constitutes a One Health team, as we were just advocating for the spirit of collaboration among disciplines and institutions. So in here, we have a team of One Health students. And we would like to thank you, Mr. Dan, for joining us today. Last year, we called upon you and you never disappointed. And again, this year, we are very happy that you were able to make it. So thank you so much. And we would like to continue with more engagements with you as we continue to advocate for better health for our communities. Asanteni sana. You all have a good evening. Back to you, Esther.
Thank you so much. Thank you, Simon. Thank you, our guest speaker, Mr. Mogaka Ayuka. With this, the meeting has ended. Thank you so much. Thank you everyone for creating time to attend this meeting. I hope you have learned a lot.
And maybe a kind reminder, before you log out, make sure you fill the attendance register for the purpose of sharing the presentations and also certificates to the participating students. Thank you all. Good evening.
Thank you. You are free to leave the meeting.